pops into my head, right? Pop. It's a pop. That. Okay? Okay. That pop test, by the way, is only for today. So, like, for people who are not here, it's unfair to those who are here. I can't give them another day for a pop test, only for today. Okay. So you should now you know, right? You're familiar. You should know when there's a stimulus. Don't forget, we're just looking at the big picture now, but always remember how does this function of the nervous system, how does it work? It boils down to generating action potential, that electrical impulse. And I hope you see that everything you do, you're writing, you're wearing, everything, nothing can function without your nerves, which rely on your electrolytes, right? Your sodium, potassium, so important, your calcium, then your chloride also. So that's why, if you're off as far as your electrolytes are concerned, if it's off, you do feel symptoms. It's your body telling you. So just quick review. This is how you should study your nervous system. So there's a stimulus. What do you call the receptor that responds to that one, right? Because of specificity. So maybe it's a So let's just say there's hot coffee. You were holding in your hands hot coffee. So that hot coffee is felt by your thermoreceptor. So that is the first order neuron, right? This is the first order neuron. You remember that? It's unipolar, right? It's part of my PNS. This is the ramus. So the first order neuron is the ramus. What ramus is this? From the hand. That must be your ventral ramus, right? So just to review, ventral ramus, enter my spinal cord. Where? Dorsal root. Don't forget, you need to be able to identify the parts of that picture. Remember, the spinal cord, right? So be able to label the different parts over here. This one, it never fails. Well, in the past, I always had a picture like this, right? You label the different parts, right? So the ventral ramus will enter the dorsal root. I know this is the dorsal root because this is the dorsal root ganglion. What is contained here? The cell bodies of all my unipolar neurons, my sensory neurons. So this is the first order, right? And then we'll enter through the dorsal gray horn, right? And synapse with the next neuron. It will go up to my brain. Through what pathway? Because it's thermo. So each ascending pathway. What specific pathway? You look at pain and temperature, so that must be spinothalamic pathway, right? Go up to the brain. So the second order neuron is the one that decussates to the other side, right, at the medulla. Then it will synapse with the third order neuron. Where's the cell body of that third order neuron? It's in the thalamus, always the thalamus, right? Then it will go to your primary somatosensory cortex, which is your parietal lobe, right? And then from my parietal lobe, it will synapse with the neurons that begins my descending or motor pathway, which is from the frontal lobe, right? So this is my primary motor. So first is the premotor cortex, then primary motor cortex in the frontal lobe, right? So this is my upper motor neuron going down. So this is my cortico-spinal, right? My direct pathway. So upper motor neuron is the one, it's the one that decussates, right? That crosses over and synapses with the second order neuron, which is the one that will lead through the ventral horn, right? I want to pull my hand away. So go out the ventral root. And what is this ramus again? For the head, ventral ramus, right? And stimulate my muscle to contract. So I will pull away. So it's always that pathway. It's always a series of pathways every day, every day. And you remember, you need to always remember that all these neurons rely on a fresh supply of glucose. Oh, look at all those neurons. They don't store their glucose. They don't have a storage shed for glucose. Only liver has that and your muscles. And so that's why we need to constantly feed them with glucose. When you wake up in the morning, you're fasting for so many hours of sleeping. You need to eat your breakfast. It's the most important meal of the day, right? So that's why your what do you call this? Your Jiffy Lube, your car will run again, whatever you call it. Okay? So, in addition to this pathway, because upper motor neuron versus lower motor neuron, don't forget the symptoms. So, if it's ascending pathway problem, you're going to have sensory deficits. But if it's descending pathway problem, it's paralysis. And you know the difference between upper motor neuron paralysis and lower motor neuron. Upper motor neuron means your problem is in your brain. Lower motor neuron paralysis means your problem did not involve the brain, but it's maybe from the spinal cord down. Okay? Which is, I guess, better than upper motor neuron injury, huh? Okay. So, and that's why I think did I talk about it's very important to assess the health of your brain. It's able to emit these waves because what it generates are what you call electrical impulses, and that's being picked up by EEG. So if they suspect any neurological problems, they can even hook you to an EEG. Okay? This one is looking at sleep because that's one of the other. We know that the neurons are constantly always firing. And we also know that we sleep. Is there a purpose for sleep?
Helps the body to regenerate.
Yeah, don't you think so? Right, it does because it's constantly firing. So that's why the reason we need to sleep is so we can replenish our glucose stores and just give them a time to go back to their resting state so that they're ready to be fired again. Okay? If you think about it, like me, I'm almost 50 years old. So sleep is normally how many hours a day? 8 hours a day? So like for me, I'm sure I have spent at least 16, 17 years of my life sleeping. If you're like my Baba who sleeps 12, 13 hours a day, you must have slept away. That's how important. Just if you think about it, divide your age by 3, that gives you a different appreciation for sleep. But young people, they think they don't need to sleep. You need to sleep. And this, you want to be able, this by the way is not going to come out in your test. Don't worry, but this is too much. But this is what you see how just by looking at these different waves, it's showing you how your neurons are very, very active. And you need to, even at sleep, look at this one. They're still constantly firing. You need to get that level of sleep called deep sleep, where the neurons are also rested. You need to give them time to recuperate and rest. If you're not sleeping properly, it can also lead to personality problems. And a lot of times, if we lack sleep, especially with kids, they can be diagnosed improperly, right? They say, she's ADD, you need to put her on medication, etc., etc. When it's just maybe diet or sleep that can fix the problem. That's why in California there is a big movement now for holistic medicine. Instead of treating patients immediately with drugs, physicians are now trying to investigate nutritional problems and trying to treat it that way. And I think that's very good. We don't need to brand our children immediately with all these diagnoses and start putting them on drugs. The last part of this chapter, which will be included in your test, is reflexes. This is the other function of the spinal cord. Okay? So we know that the spinal cord, here's my spinal cord, right? The spinal cord connects the brain with your PNS, right? Your effector organs, right? That's how I'm able to become aware of whatever is going on around me. But there are instances where I cannot wait for my brain to figure out what's going on. Just looking at this pathway, there's the first order, second order, third. It takes a while, right? At the synapse, there's a synapse where there's a delay there, right? You have to release neurotransmitter. Neurotransmitter has to initiate events with the second order. So there may be a delay. Like when you step on something very sharp, you have to pull your foot right away before you say ouch, right? And so that's the function of reflex. Look at this one. It is an immediate involuntary reflex to a specific stimulus. So it's always the same kind of response again and again and again. And it's meant to save us from possible harm. Okay? And we classify reflexes several ways. See? Innate means you're born with it. And that's what we test for when the baby is born. There are some reflexes like, have you heard of the Moro reflex? Where that's how they test the baby if the baby is born premature or term. They do all these kinds of reflexes. The blinking reflex that we all do, right? You poke and then you blink. That's a reflex. So that's innate. You're born with it. And then the learned reflexes, you say it's acquired. Like stepping on your brakes, that's an acquired reflex, right? Or learning. There's a lot of reflexes that we learn. What other reflexes? Immediately reaching for your phone. When you hear a ding, you know you reach for. All of those are acquired reflexes. Then, depending on the effector organ, right? Do you remember now? Somatic means skeletal muscle is the one that responds. So you call that somatic reflex. Okay, so like the withdrawal, that's a somatic reflex because what was involved was my skeletal muscle. There's also visceral reflexes inside. Like if my blood pressure is high, automatic, I have reflexes that will bring it down. We're going to study that when we take up the cardiovascular system. So that's called a visceral reflex. Does it make sense? Okay? Or if you need to go to the bathroom, isn't that a reflex? The sphincters relax. It's a reflex. So that's a visceral reflex. And then how many neurons are involved? So you can say it's a monosynaptic if it's one synapse. Meaning, isn't this the simplest type of reflex? Because there's only two neurons involved. The sensory synapses with the motor, monosynaptic reflex. Right? If there's more than two neurons, many synapses, you say it's a polysynaptic reflex. Then, which one is responding? You think it's a spinal cord reflex? Anything from the neck down is spinal reflex, right? Here you call it cranial reflex. So like the blinking or all of those reactions that you do when you hear a loud blast, that's a cranial reflex, okay? The past tests, so this is a typical reflex arc. You see, you bypass the brain. That's what reflexes are. It bypasses the integrative center in the brain. So in other words, there's a pathway that still goes to the brain. but you took care of the problem while waiting for the brain to figure out what was going on. This is what you mean by a reflex. In the past, I would always have pictures like this, maybe, okay? And you tell me what type of reflex you see here. So the typical reflex that we are familiar with is like the withdrawal reflex, right? Let's look at this picture over here. In addition to those classifying the reflexes according to sight, according to the effector response, or is it innate or acquired, some reflexes involve several segments of the spinal cord. Let's say this, your quads, there's several segments of the spinal cord that have neurons that take care of the different muscles that make up your quads, the anterior compartment of the thigh. And those neurons, they come out of, let's say, L2 to L4. So I'm going to call this an intersegmental reflex. In the past test, I had pictures like this. And then it will be true or false. I'll say, the picture shows an intersegmental reflex, true or false. The picture shows monosynaptic reflex, true or false. I don't see a monosynaptic reflex. See, there's the one neuron, right? Two, there's three. So if there's more than two neurons, I know it's not monosynaptic. It is polysynaptic, right? You heard of ipsilateral and contralateral reflex? Do you know what ipsilateral means? It's on the same side. So if my right foot is the one that stepped on a pin, the reflex response of my right foot pulling away, that's called withdrawal, right? Withdrawal reflex. That's an example of ipsilateral reflex. So ipsilateral means the reflex response on the side of the stimulus. Okay? And the other side, what do you think? This other leg that didn't step on the pin, it had to reflexly extend at the knee joint. So I can support the one that I withdrew. That's an example of contralateral reflex. Do you see the difference between the two? Ipsi. So in this picture, I'm thinking this is the one. I see both ipsilateral and contralateral reflex here then, right? This is ipsilateral, it pulled away from the stimulus. This is my withdrawal reflex. And this one, the left foot, had to support the right foot. So that's an example of a contralateral reflex. At that moment, it had to extend to support the right foot or right leg. You follow? There is also what you call what's this?
Polysynaptic?
No, we know that it's monosynaptic and polysynaptic. There's also what you call, what's the term? Antagonistic inhibition, not antagonistic. There's a better term. Oh my goodness, what is the term? It's called... What's the term? What is that term? Antagonistic inhibition? No. What is that term?
The only thing in here I can find that says antagonistic is antagonistic muscle control.
No. I will remember. So it is antagonistic inhibition. I'll remember the nicer term. There's a nicer term. I don't like this term. It's ugly for me. But what this means is, when you withdraw from a stimulus, let's say I flex, so what contracted here is my biceps, right? At this point, if you look at this one, my triceps is being stretched. So what is the response of muscle when you stretch it? It contracts, right? So that's how you go back to your anatomical position. But at that point of the reflex, you want to be really far from the offending stimulus. There's a possibility that if this one contracted, I'm going to go back to that offensive stimulus. So what's happening is this antagonistic muscle is being inhibited. That's why you say antagonistic inhibition. At the time of the reflex response, you want to inhibit the antagonistic muscles from contracting, because that's what it does. Any kind of activity, if you're not in the anatomical position and you're contracting something, the antagonist muscle that was stretched, it will contract. But at that point of the reflex response, you want to inhibit it. And there is a nicer term that I will remember, I'm sure. Okay? Okay? So do you have any question on the different reflexes? In the past test, this is the type of picture that I had in previous tests. And I just ask you, do you see an intersegmental reflex here? You see a monosynaptic reflex here? What do you think? Do you see a somatic reflex? Yes. Do you see a visceral reflex? No. How about cranial reflex? No. Spinal reflex? Yes. Right? Do you see a motor neuron?
Yes.
You see a sensory neuron?
Yes.
How about interneuron?
Yes.
Yes. Where? Right there, right? There's an interneuron, right? What do you think? Can you tell me what level of the spinal cord this could have not been taken from? For sure. Yes, because the thoracic always has that lateral gray horn, remember? If there's no lateral gray horn, for sure it was not taken from the thoracic level. Okay? And that's the end of, I think, the spinal cord. So you know your pathways. Don't forget those pathways, okay? Spinocerebellar, spinothalamic, and all that stuff. Just so you know, the test on Wednesday is not partner. So don't come to me asking me, can I have a partner for this test? No partner on Wednesday. You're on your own, okay? But remember, if you forget the pathways, I think in the past, I already wrote down the pathways. But if you forget, just remind me, I'll write it on the board. So the different ascending pathways. The descending pathways, there's only two, right? The direct and indirect. So corticospinal, if it involves skeletal muscle contraction. If it's not skeletal muscle, those are called indirect, which means the effector organ is my internal organs, like corticobulbar for my face, right? Anything that starts with cortico is direct pathway. You're conscious, beginning from your cerebral cortex, okay? If it doesn't start with cortico, I know it is an indirect pathway, and the effector organs are my internal organs. Let's say tectospinal, rubrospinal, okay? And then don't forget, what else? Your plexuses, right? Your cervical plexus, brachial plexus, lumbar plexus, and your sacral plexus. And so that's it for this chapter. I think we're done. Now we're going to start